16 states have passed laws permitting the sale of medical marijuana to sick people who receive a prescription from their doctors. But this approach doesn't exactly align with the federal government's stance on marijuana, and the idea and the government, the DEA, continues to raid dispensaries. So will the feds and the states ever be on the same page on this issue? Here to discuss his stance and experience with medical marijuana, the world-renowned talk show host and my friend, Montel Williams, who uses marijuana to address symptoms related to multiple sclerosis. Montel, it's a pleasure.
Thank you so much.
Thanks for coming here.
Oh,
How is it that you're able to use marijuana lawfully wherever you go?
Well, I should say here in Manhattan, under the former district attorney who here was District Attorney Morgenthau,
right?
He literally gave me a pass at a public forum and said that if I was ever caught with marijuana in the city, he would not prosecute. But now legally I can't in the state of New York. I have to be one of those prisoners, if you will, of war. This is one of these wars that we put on in this country where we're leaving the patients on the battlefield and should take them off. So legally in New York I can't. California I can.
Just briefly, what do you use marijuana for and what does it do for you?
Actually, everybody pretty much knows that I've been very public with the fact that I was diagnosed with MS now about 11 years ago, 12 years ago to be exact. And MS, when I first got diagnosed, I had slight neuropathic pain, but I have neuropathic pain, I have spasticity, and I have some other, cramping issues in my lower extremities. And after having exhausted every form of opiate that there is to the point of almost shutting down my kidneys and liver, I decided to take a different approach, and that approach was then with cannabis. Now, this approach is nothing different than our federal government has done in the last 36 years.
All right, you have something with you, which is a canister, and when I asked you before we started the segment, what is the canister, you told me that comes from the federal government. What does the federal government put in that?
The United States government for the last 36 years has been growing, researching, and dispensing marijuana at the University of Mississippi and sending it out to, it started with 20 patients, it's now down to 4 to 7, we don't know exactly, because as each patient dies off, they are discontinuing the program.
Let me get this straight. The same government that prosecutes people for using marijuana pursuant to medical prescriptions gives it to people.
Once a month, every month, the 17th of the month, it goes out now to 7 pharmacies across the country. But let's look at exactly what it says. It says here 300 marijuana cigarettes. So it's sending out 300 joints, but it's turning around and busting people. Let's also take it one step further. In '96, the U.S. government, through its research in this program, proved the efficacy of marijuana to the extent that it issued itself its own patent.
The U.S. government issued itself a patent on growing and distributing marijuana. The public doesn't know this.
Correct.
But this is a tremendous debate. It involves the following issues. Do we own and control our own bodies?
Correct.
Is it any of the government's business what we put in our bodies? Can the states nullify and resist federal intrusion in an area that they regulate, which is the practice of medicine?
Yes, sir.
When they say, like in California, their doctors can prescribe marijuana.
And they say they can recommend because the federal government won't allow a doctor to prescribe. They have to write a recommendation. But here, in the last year and a half, we've heard the Tea Party. We've heard everybody say it is time to get the federal government out of our health care. Well, why on earth would the federal government want to get in between me and a doctor? My doctor, who has the ability to prescribe me any other drug on this planet, has recommended for me this as my choice of a weapon in his arsenal for my illness. So why should I not believe him?
Why in this environment, when the medical profession is with you, when many politicians are with you, when many civil libertarians are with you, when many fellow patients are with you, are there more marijuana arrests than there were 10 years ago?
I think it's one of the things that's so egregious about it is that if you also track the marijuana arrest, you'll also note that there's a disparity in the color of those being arrested, especially here in the state of New York. About 72% of those arrests here, the 349,000 under this current mayor, is, I believe, African American or Hispanic. And so why is there such a disparity in the way that we arrest and we prosecute for something that, again, our government has deemed necessary for patients? Now, I'll ask you this question, because, Judge, look, this is one that I've asked around the country. I did 22 years in our military supporting and defending this Constitution of the United States.
Right.
Overseas and here. Now, why is it that I can come home and our government will allow someone else to have medication and tell me, go, myself?
The government is hypocritical and the government doesn't care about our rights. Montel, we got to go. You're a courageous guy. I appreciate you coming here.
Thank you so much for having me, sir.
Thanks for joining us.